Local anesthesia, anterior superior alveolar block. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 27-gauge short needle, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The anterior superior alveolar, or ASA block, is commonly used in conjunction with the middle superior alveolar block in place of an infraorbital block. The ASA nerve serves as an efferent nerve of sensation, including pain, for the maxillary central incisors, lateral incisors, and canine, as well as the associated tissues. The ASA nerve originates from dental branches in the pulp of these teeth that exit through the apical foramina. The ASA block anesthetizes the pulp of the maxillary canines and incisors, as well as the associated periodontium and facial soft tissue, including the gingival tissue. If palatal or lingual anesthesia of the soft tissue of these teeth is desired, a nasopalatine block may also be necessary. The landmarks for this injection are the canine eminence, the canine fossa, the maxillary mucobuccal fold, and the maxillary canine. The deposit location or target area for the ASA block is the anterior superior alveolar nerve at the apex of the maxillary canine. The injection site is the height of the mucobuccal fold at the apex of the maxillary canine, just anterior to and parallel with the canine eminence, and approximately a 10-degree angle off an imaginary line drawn parallel to the long axis of the tooth. This is slightly over the slight depression or canine fossa located anterior to the canine eminence. You will place the needle tip superior to the apex of the maxillary canine without meeting resistance or contacting bone. Load the local anesthetic syringe as demonstrated in the procedure loading the metallic or plastic cartridge type syringe. Before injection, follow all steps as demonstrated in the procedure basic injection technique. Assume the correct operator position for a right-handed clinician at 8 o'clock, right side, or 9 o'clock, left side, or a left-handed clinician at 4 o'clock, right side, or 3 o'clock, left side. Ask the supine patient to open his mouth and tilt the head back for greater visibility. Retract the upper lip, pulling the tissue taut. You may use a piece of sterile gauze to help retract slippery tissue. Palpate the canine eminence and fossa, which is the slight depression anterior or medial to the eminence. Dry the needle penetration site and prepare the alveolar mucosal tissue with topical anesthetic in the vestibule at the height of the mucobuccal fold superior to the apex of the maxillary canine, just anterior to and parallel with the canine eminence. Topical anesthetics are most effective for patient comfort when applied for 1 to 2 minutes. Dry the tissue to remove any excess topical anesthetic. Using a 27-gauge short needle with the syringe in the dominant hand, orient the bevel of the needle away from the large window of the syringe to ensure that the bevel orientation is toward the bone. Establish a fulcrum that allows you the greatest stability of the syringe. Place the syringe parallel with the long axis of the tooth, with the large window facing you. Insert the needle at the height of the mucobuccal fold at the apex of the maxillary canine, just anterior to and parallel with the canine eminence, at approximately a 10-degree angle off an imaginary line drawn to the long axis of the tooth, and insert approximately 1/4 the depth of the short needle, approximately 5 millimeters, or until the bevel is slightly superior to the apex of the tooth. You should meet no resistance or bony contact. Aspirate by pulling the thumb ring back gently on 1 to 2 millimeters at the injection site to prevent the possibility of an intravascular injection. If aspiration is negative, slowly deposit approximately 0.6 to 0.9 milliliters of solution, 1/3 to 1/2 of the cartridge, over approximately 30 to 60 seconds. If the tissue balloons, the deposition of solution is too rapid. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. Wait approximately 3 to 5 minutes until anesthesia takes effect before beginning treatment. Crossover innervation may occur when the anterior superior alveolar nerve crosses over the midline to the contralateral side in a patient. You may need to take this into account when using local anesthesia in this area. Bilateral injections of the ASA block or supraperiosteal injections over the contralateral maxillary central incisor may be indicated if the patient still reports discomfort during treatment. Complications from this injection are minimal and include pain on injection from needle insertion against the periosteum, pain on injection from too rapid injection, ballooning of the tissue, hemorrhage at the site of injection, inadequate anesthesia from injection into infection, and incomplete anesthesia due to crossover innervation from the anterior superior alveolar nerve on the contralateral side.